Okay, somebody tell me when. Yeah? Okay. Great. Okay. Good afternoon, everyone. I'm Mayor Paulette Guajardo, and thank you for joining us for the COVID-19 briefing. First, I'd like to start with some good news. I believe highlighting all of our wins is very important. Last week, Johnson & Johnson shipped 4 million vaccines across the country. Texas Governor Greg Abbott has reported that Texas should receive more than 200,000 initial doses of the newly approved vaccine. On Saturday, March the 6th, HEB administered 1,100 doses of the Johnson & Johnson vaccines at the American Bank Center. Johnson & Johnson is expecting to distribute 100 million more doses by June and 1 billion by the end of the year. I would also like to acknowledge the life-saving partnerships that are contributing to the increase in vaccinations, such as the one that the City of Corpus Christi has with Driscoll's Children's Hospital. 4 COVID-19 vaccination clinics will be taking place this week with 9,000 vaccinations administered. On Wednesday, March 10th, Driscoll Children's Hospital will be administering 2,000 first-dose Pfizer vaccines at the American Bank Center to educators in our area. On Thursday, March 11th, Driscoll Children's Hospital would be administering 1,000 second-dose Moderna vaccines also at the American Bank Center. On Friday, March the 12th, they will be holding another second-dose Moderna vaccine clinic at the American Bank Center with 1,000 doses administered. People who are receiving their second dose at the March 11th and 12th clinics have already been contacted and registered. On Saturday, March the 13th, the City County Health District will administer 5,000 second-dose Moderna vaccines for people who received their first dose on Tuesday, February the 9th. This clinic will be held at the Richard Borchard Fairgrounds at 1213 Terry Shamsey Boulevard in Robstown, Texas. There have also been other vaccination clinics throughout the city that are taking care of our community, such as the vaccination clinic at St. John Baptist Church and the Driscoll CCISD clinic that took place both this last Saturday, March the 6th. It is really uplifting to see the community teaming up to take care of each other. Another part of controlling this pandemic is knowing where the virus is in the community. This week, there will be a free COVID-19 testing at the old Memorial Hospital site located at 2606 Hospital Boulevard, today, March the 9th, through Saturday, March the 13th, from 7:30 a.m. until 1 p.m. And to register for a free COVID test, you can visit the nuasisco.com website. And I'm very proud and grateful of the hard work that our team is doing to protect you and our entire community. There's more positive news to share regarding our Saving Our Seniors Homebound program. Our SOS program has been recognized as a model for the state by Governor Abbott. It was my honor to welcome the governor to Corpus Christi, where he announced that he was taking our Save Our Seniors Homebound program administered by our Corpus Christi Fire Department statewide. 1,100 National Guardsmen from across the state are using our model to vaccinate homebound seniors. Governor Abbott is delivering vaccines to 26 counties to launch the statewide program. Some of those counties include Aransas, Bastrop, Dallas, Refugio, and Webb counties. It is humbling to see our Corpus Christi program become a blueprint for Texas to follow, knowing that it will impact the lives of so many vulnerable homebound seniors for the better. So this accomplishment is truly a gold star for our city, and I'm so proud of the outstanding work that our firefighters and Chief Rocha have made and their contribution to this successful program. We still have bold goals for our Save Our Seniors program, though. As it stands now, we are aiming to complete all second dose vaccinations by this Friday, March the 12th. And here we have some more really good news, and I know a lot of you have been waiting for this. We will be opening the Saving Our Senior Hotline this Friday, March the 12th at noon, and registering 500 homebound individuals for vaccinations in their homes. Please keep in mind that the Save Our Seniors program can only operate when there is supply to administer. Once the 500 registrations are complete, the phone lines will close until the next registration opens at a later date, which we will announce as we are today. My office has also launched a new resource for the Save Our Seniors program. Residents can now visit the city website at www.cctexas.com/SOS for information on the program. The new website features hotline registration information and frequently asked questions to help you guide our seniors and homebound through the process of registering for the SOS program. Our outlook for vaccination administration is positive. Your city-county health district is anticipating vaccine allocation will increase significantly in the coming weeks due to the addition of the Johnson & Johnson vaccine that we've heard so much about. We are receiving more doses, and we are responding to the demand for the vaccine. To date, countywide, we have administered over 100,000 vaccinations, and you can track this progress on our city website at cctexas.com/vaccine registration, where the total number of vaccines administered countywide are listed along with the number of vaccines administered by the city-county health district. So there is definitely hope on the horizon. We look forward to it. We continue to work in partnership with many entities, and we hope that, you know, what's ahead of us is absolutely something that is the best for the community, and that we all are going to get out of this together. But a year ago, I want to remind everyone that Corpus Christi was watching as the COVID-19 pandemic hit the shores of the United States. And on March the 21st of 2020, officials had confirmed that day the first coronavirus in our country. And a year later, I want to acknowledge that our healthcare providers, the brave doctors, nurses, and hospital staff that have worked tirelessly to protect our families continue to do so today. Today, we are a step closer to the protection that we need to recover from this devastating pandemic. So thank you. At this time, I'll let Gabby translate that, and then we will hear from our city manager, Peter Zanoni.
La semana pasada, Johnson & Johnson envió 4 millones de vacunas en todo el país. En Texas se espera recibir más de 200,000. El sábado 6 de marzo, H-E-B administró 1,100 dosis de esa vacuna. Johnson & Johnson espera distribuir 100 millones de dosis más para junio y 1,000 millones para fines de este año. Esta semana se van a llevar a cabo 4 clínicas de vacunación COVID-19 en donde se van a administrar 9,000 vacunas. El miércoles 10 de marzo se van a administrar 2,000 vacunas Pfizer de primera dosis para los educadores de nuestra área. El jueves 11 de marzo se administrarán 1,000 vacunas de la compañía Moderna de segunda dosis. El viernes 12 de marzo se van a llevar a cabo otra clínica de vacunación Moderna de segunda dosis con 1,000 dosis administradas. El sábado 13 de marzo se administrarán 5,000 vacunas Moderna de segunda dosis a las personas que recibieron su primera dosis el martes 9 de febrero. Esta semana habrá pruebas de COVID-19 gratuitas en el antiguo Hospital Memorial. Desde hoy, martes 9 de marzo, hasta el sábado 13 de marzo se puede registrar a la dirección www.nuecesco.com. El programa Save Our Seniors, o SOS, administrado por nuestro Departamento de Bomberos, ha sido reconocido como un modelo en todo el estado. 1,100 guardias nacionales de todo el estado lo están usando para vacunar a las personas mayores confinadas en sus hogares en 26 condados del estado. Localmente, nuestro objetivo es completar todas las vacunas de segunda dosis para este viernes 12 de marzo. También anticipamos la apertura de la línea directa SOS este viernes 12 de marzo al mediodía y el registro de 500 personas confinadas en el hogar para que se vacunen en sus hogares. Este programa está abierto a registros solo cuando se cuente con esas vacunas. También contamos con un portal nuevo de internet de mi oficina a la dirección www.cctexas.com/SOS, en donde podrá encontrar información sobre este programa. A la fecha, se han administrado 146,196 vacunas en el condado de Nueces. Hace un año, el 21 de marzo del 2020, fue el primer caso del coronavirus reportado en los Estados Unidos. El día de hoy estamos a un paso más cercano para poder encontrar la cura.
Good afternoon. I'm Peter Zanoni, Corpus Christi City Manager, and today I'm going to speak about the mask requirement that we have here for the city in two categories, one for our city employees, and then secondly, for patrons and residents entering city facilities. And so we know recently the governor did issue amended orders that reduce the need, or the requirement, I should say, for masks. However, his order did not preclude an organization like the City of Corpus Christi from issuing protocols to continue the use of face masks, right? So his order did not preclude or didn't stop the city from having our own requirements. And so knowing that, last Friday, I notified all our city employees, all 3,000 plus employees, that we are going to continue to require them, our employees, to wear face masks. And the reason that is many city employees have not had the opportunity, or they're not even eligible to receive the vaccine under the governor's orders of just having 1A and 1B be eligible, the groups of Category 1A, healthcare providers, 1B, primarily seniors, and then persons 16 and older that have some type of a comorbidity or health issue. And so many of our city employees don't fit in that category. They would be in the next category or the next categories. And so until a vast number of city employees are eligible and have been vaccinated, I am going to keep the mask requirement in place so that employees can feel safe coming to work. Some city employees, our first responders, our employees that are over 65 and others have been vaccinated, but I would submit that the vast majority have not. And we want all our employees to feel safe when they come to work each day. And so for that reason, last Friday, I notified all employees that they'll still be required to wear masks in our office environments. That's not only at City Hall, but many of our other office environments that we have across the city. Now, let's talk about residents and patrons coming into city facilities like City Hall or other city facilities that are open to the public, libraries, some senior centers. As a city manager, it is my purview to require masks or not in a city facility. As a city manager, I oversee the actual building of the facilities. And so as city manager, I'm recommending and issuing today with this statement, and then we'll also put a media release out, that we're going to continue the protocols that we have in place today, which is masks are required when entering a city facility, as will be a temperature check, and that happens for our employees as well. Not only do they wear a mask, but they receive a temperature check. So for the general public entering City Hall, our libraries, any city facility, you will be required, patrons still will be required to wear masks and get their temperature checked. And the reason being is the same reason we're recommending that requiring that for city employees, and that is that the vast majority of our population still is not eligible to receive the vaccine. They don't fall in that category 1A or 1B. And so we want all patrons to feel safe when they come into city facilities. And then also, just as important, we want our city employees who are servicing or helping those patrons come into our city facilities. We want them to feel safe as well. And so going forward, we'll continue the mask requirement, not only for patrons, but for our city employees as well. We'll keep the community advised as our health director's here, and she'll talk about vaccines that are coming in and how we're progressing as a community and vaccinating the community. But as we move forward in the weeks and probably a couple of months ahead, things will look much better, I think, in terms of how many persons are vaccinated. And we'll revisit those requirements. But just, again, for right now, we're going to keep the same protocols that we have in place. in place today. They'll be in place tomorrow. The governor's order goes into effect midnight tonight or 12:01 tonight. But for us at the city here, we'll be keeping the same protocols in place. So with that, that concludes my comments, and I think we're going to get that translated. And then Annette Rodriguez, our Public Health Director, is going to come up and speak as well. Thank you.
Quiero hablar sobre la orden del uso de cubrebocas. El gobernador indicó que el uso de cubrebocas no es obligatorio, pero no nos detiene a contar con nuestros requerimientos. Los más de 3,000 empleados de la ciudad van a tener que seguir usando el cubrebocas, ya que muchos de ellos no han logrado ser vacunados. Este requerimiento va a continuar hasta que la mayoría hayan sido vacunados. Quiero que los empleados se sientan seguros de venir a laborar. En cuanto a los visitantes a las instalaciones de la ciudad, yo estoy a cargo de estas y hoy emito la orden de continuar el uso de cubrebocas y la toma de temperatura en todas las instalaciones de la ciudad. Y la razón es la misma, la seguridad de los empleados y de todos los visitantes.
Good afternoon, Annette Rodriguez, Health Director. I'm going to start out with the COVID-19 statistics. You see them on the right of me, and what you'll see is that the numbers are still high. If you look all the way to the right, 92, 72, 87, 69, these are double-digit numbers. But if you look at March 7th, 103 cases. So again, we're in a very precarious situation right now, and we really have to watch these numbers carefully. Last week, we had 498 cases. This week, from March 3rd to the present, 377 cases. We currently have a transmission rate that's over 1, which means that you really have to work hard to get those numbers down if you're going to be effective at mitigating COVID-19. Next slide, please. So this is the pie diagram. In this diagram, you see 36,498 people have recovered from COVID-19. You see 1,000 persons have active COVID-19 in Nueces County. You see a total of 730 deaths for a total cumulative number of 38,270 COVID cases in Nueces County since the beginning last year. Next slide. Hospitalizations continues to stay fairly stable. If you look all the way to the right, you see 91 hospitalizations 2 weeks ago. But if you look out throughout the last 2 weeks, the numbers are right around 70s, and currently today at 75 people hospitalized due to COVID-19. Next slide. The number of people in the ICU actually has dropped a little bit, which is really, really a good thing. Usually if people get, discharged from the hospital, but sometimes some of these individuals will have died from COVID-19. 37 cases 2 weeks ago, 35, 32, and now we're down to 26 people in the ICU as of today. Next slide. So the total COVID-19 deaths, of course, this is a cumulative number, so you're always going to see an increase. 730 people in Nueces County have died from COVID-19 or related to COVID-19 illness since the beginning of this pandemic. And the last slide for the statistics are the daily COVID-19 fatalities. If you look at last week, and that's the week of February 24th, through March the 2nd, you see 15 deaths for that first week on the far right of the slide. And for this past week, we've had 12 deaths due to COVID-19. Today, we had one person that died in their 20s with a COVID-related death, and we had 3 individuals in their 60s, 2 females, 2 males. They did have diabetes, high blood pressure, and our condolences do go out to the families that lost their loved ones. Now, switching hats a little bit, we want to talk a little bit today about the variants that we're all kind of curious about. So the Health District continues to distribute vaccine with a sense of urgency. And the most important reason why the Health District and the rest of the world continues to find ways to mass vaccinate large numbers of people is to ensure we are all doing our part to suppress the virus as quickly as possible. The reason we're trying to suppress the virus is twofold. One is the faster we achieve herd immunity, which means 70% or more of the population is either fully vaccinated or they have natural immunity from having the virus, the quicker we can all get back to a semblance of what our lives used to look like. The second reason is that the virus is mutating and new variants are appearing. Many are now wondering about the coronavirus variants. What are these variants? What do they do? And what can we do to suppress them? We all have the same questions. We all want a yes/no answer as to whether the current vaccines will be able to protect against these new variants. It's a quite complex question, so let's first step back and try to understand what is happening. In viruses, as they duplicate themselves, the replicas or mutants won't always look exactly the same. The virus has a mission to improve its chance of infecting its recipient. So it will do whatever it has to do, even mutating to accomplish this mission. If we look at the model of the coronavirus, it has spike proteins, which you see as little red bumps, on the virus. These, we sometimes call them little red flowers with the 3 little petals on them. These petals, if you will, are able to open or close. When they are open, they can attach to the human cells more easily. At the beginning of the pandemic in 2020, these little petals were closed, which meant the virus could not spread very easily. But it is believed the virus changed in an area of the spike protein, the red petals. The petals opened in this mutation, which made the virus more able to attach to the human cells. Some scientists even believe this variation of the virus took the place of the original configuration, and it quickly spread around the world by June 2020. It seems this may be happening with other variants around the world. For instance, the variant that was first reported in the United Kingdom was first seen in September of 2020, and now it's the dominant strain of the virus in the UK, and it may be what happened in South Africa as well. Currently, the new variants of this virus that cause COVID-19 are creating concern. We have attached a picture with the flags that correlate with the variants. These variants seem to spread more easily and quickly among people, causing more infections with the COVID-19 virus. All 3 variants have now been identified here in the United States, as well as many other countries. Information about the characteristics of these variants is rapidly emerging. Scientists are working to learn more about how easily they spread, whether they could cause more severe illness, and whether currently authorized vaccines will protect people against them. The variants include the B.1.1.7 in the UK, all the way to the far right, a variant of SARS-CoV-2 known as the B.1.1.7. This variant carries a large number of mutations and has since been detected around the world, including the United States. This variant was first detected in the US at the end of December, just a few months ago. In January of this year was the first time that we saw this variant in Nueces County. Scientists from the UK reported early evidence that suggests that the B.1.1.7 variant may be associated with an increased risk not only of transmission, but also of death compared with other variants. More studies are needed to confirm this finding. The B.1.351, the South Africa, is another variant of SARS-CoV-2, known as the B.1.351, emerged independently of the B.1.1.7. This variant was first reported in South Africa. This mutation is changing its shape so that antibodies that used to fit over the spike protein, those little red petals that used to fit over it, no longer fit. So this is just a very rudimentary example. It was shaped like a circle originally. We're talking about the petals, those red petals. They were shaped like a circle, and the antibody was also shaped like a circle. Therefore, you were protected. It would cover those red petals. Those red petals could not transfer to the human cells and could not continue to replicate. But now the mutation has changed this spike protein shape to a triangle. And now the antibody that is a circle trying to cover the triangle leaves parts of it out, which is still exposed enough to be able to transfer to a human cell and continue to replicate. The South Africa variant was first detected in the US at the end of January 2021. Preliminary evidence from non-peer-reviewed publications suggests that the Moderna, the mRNA, vaccine currently used in the United States may be a little less effective against this variant, but additional studies are needed. Finally, the P1, right in the middle. In Brazil, a variant of SARS-CoV-2 known as P1 emerged. It was first identified in January of 2021 in travelers from Brazil who arrived in Japan. This variant was detected in the United States at the end of January 2021, just 2 months ago. The P1 variant has 17 unique mutations, including 3 in the receptor binding domain of the spike protein. Again, all of these are in the spike protein. According to the non-peer review articles, there is evidence to suggest that some of the mutations in the P1 variant may affect the ability of the antibodies from natural infection or from vaccination to recognize and neutralize the virus. But additional studies are needed, which means that the vaccine or even you having COVID-19 could actually not protect you against the P1, the Brazilian variant. In all these variants, the mutation seems to be in the spike protein of the virus. Mutations of the spike protein receptor, next slide. Mutation of the spike protein receptor could have the following possible changes. Number one, it could ease the spread from person to person, like we see in the B117 that we currently have in Nueces County. Number two, it could cause more severe disease in people, like the B1351 from South Africa, and now even the B117. These variants may also not respond to medicines currently being used to treat COVID-19 patients. And finally, it could change the effectiveness of COVID-19 vaccines. These changes could lead to an increase in the number of cases which will put more strain on healthcare resources, lead to more hospitalizations, and potentially more deaths. So what do we have to protect us from these mutations? Antibodies. These are proteins that defend the body against the spike protein. Think of them as the shield that will block the COVID-19 spike protein from attaching to the human cell. Your immune system makes antibodies when you receive the COVID-19 vaccine, or naturally it'll make antibodies if you were infected with the COVID-19 virus. So far, studies suggest that antibodies generated through Moderna, Pfizer, and J&J, these authorized vaccines, recognize these variants. We also know that vaccines help those who do get sick to get a much milder illness and not end up hospitalized. However, these vaccines are being closely monitored and more studies are underway as mutations continue to occur, as the virus continues to spread. Rigorous and increased compliance with public health mitigation strategies such as physical distancing, use of masks, hand hygiene, and isolation and quarantine is essential to limit the spread of the virus that causes COVID-19 and protect public health. Getting vaccinated as soon as eligible with the vaccine on hand is also another tool to keep variants at bay. Remember, if the virus cannot replicate, the virus cannot mutate. Our mission currently is to keep the virus from replicating, and the only way we're going to be successful is to vaccinate with a sense of urgency and keep people from getting the virus. But you too must do your part. Continue to wear a mask, as City Manager Zanoni mentioned. Don't let your guard down. We have not worn masks like this in over 100 years, since the Spanish flu of 1918. Life is far from normal. Don't act like it isn't. Protect yourself and others. We are currently registering individuals both online and on our Health District hotline, 361-561-1101, for future vaccination clinics. If you are eligible, please sign up to come to one of our future mass vaccination clinics. We typically have the Moderna vaccine, which requires 2 doses, 1 month apart. But we will vaccinate with whichever vaccine the state sends us. The new CDC guidelines that came out yesterday, we're getting a lot of questions on them, so I'm going to talk briefly about them. These guidelines are now allowing people that have been fully vaccinated, which means it's been 2 weeks since your last vaccine for the 2 dose, or it's been 2 weeks since your 1 dose, Johnson & Johnson, that means you're fully vaccinated. So you're allowed now to be in close quarters with other fully vaccinated individuals without wearing a mask. It basically says that you can do that with 1 household, only 1. So very close extended household members, you can do that. It also allows for grandparents to see their grandchildren if they are fully vaccinated, even if the grandchildren and the parents are not vaccinated. Just make sure that the parents and the children are not sick and they are not practicing risky behaviors. Stay well, get vaccinated, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 42 casos confirmados por el coronavirus. 36.498 pacientes se han recuperado por completo, 75 continúan en el hospital, 26 están en la unidad de cuidados intensivos, 1.042 son casos aún activos. El día de hoy se reportan 4 fallecimientos, a la fecha los fallecimientos totalizan 730 personas. Tan solo la semana pasada se reportaron 498 casos activos. El Distrito de Salud continúa vacunando a la población con un sentido de urgencia. La meta es poder suprimir el virus lo más pronto posible. Una vez que hayamos vacunado el 70% de la población, habremos logrado la inmunidad colectiva. Además de que el virus ha estado mutando, existen muchas preguntas sobre estas variantes y sobre todo si las vacunas protegen contra las mutaciones del virus. Cada vez que el virus se multiplica, las mutantes no son idénticas. En el caso del coronavirus, las coronitas que aparecen de color rojo abren y cierran. Cada vez que abren, se adhieren a las células humanas fácilmente. Esto se cree está ocurriendo con las variantes en todo el mundo. La primera variante se reportó en el Reino Unido, posteriormente en Sudáfrica. Son 3 las variantes que causan preocupación ya que se propagan más fácilmente causando más infección. Las variantes son la B117, originada en el Reino Unido. Ahora se ha detectado en todo el mundo, incluyendo los Estados Unidos. Se cree que esta variante está asociada con mayor riesgo de muerte. La B1351, de origen en Sudáfrica, fue detectada en los Estados Unidos y se cree que la vacuna actual Moderna puede ser menos efectiva contra esta variante. La P1 de Brasil también ha sido detectada en los Estados Unidos. Se cree que esta mutación puede afectar la capacidad de los anticuerpos para reconocer y neutralizar el virus. Se cree que las mutaciones se encuentran en la proteína S del virus y pudiera tener los siguientes cambios: facilidad de transmisión de persona a persona, causar una enfermedad más grave en las personas, responder a los medicamentos que utilizan actualmente para tratar a las personas por COVID-19 y así como afectar la efectividad de las vacunas. Los cambios podrían conducir a un aumento en el número de casos, lo que conlleva al uso de más recursos médicos, más hospitalizaciones y más muertes. El ser humano cuenta con anticuerpos para defenderse de estas mutaciones. Su sistema inmunológico produce anticuerpos cuando recibe la vacuna contra el COVID o de manera natural si fue infectado con el virus. Los estudios sugieren que los anticuerpos generados a través de las vacunas Moderna, Pfizer y Janssen reconocen estas variantes. Las vacunas también previenen que una persona contagiada enferme gravemente. Las estrategias de salubridad como distanciamiento físico, el uso de cubrebocas, el lavado de manos y desinfección de superficies va a ayudar a la prevención del contagio. Continuamos registrando a personas para que sean vacunadas por internet, así como por teléfono. Ese número es el 361-561-1101. que serán atendidos en clínicas futuras. Normalmente utilizamos la vacuna Moderna, la cual requiere de 2 dosis administradas con un mes de diferencia. Asimismo, las nuevas reglas de los CDC en cuanto a las personas vacunadas indica que las personas que ya han estado vacunadas pueden estar en lugares cerrados con aquellos que no lo están, pero asegúrese de que esas personas no estén enfermas.
Thank you, Gabby. So I do want to make one more comment the CDC just mentioned as well, and that's that if you're fully vaccinated and you're exposed to somebody with COVID-19, you do not have to quarantine any longer. So we used to say quarantine for at least 10 days. No longer have to do that. You just self-monitor, make sure you're not sick, and you can continue your daily business as usual. That's all I have. Are there any questions? Okay. Sure. Okay. Is the mic on?
So, someone said that they were told that the out-of-town nurses brought to Corpus Christi to help with COVID patients will be leaving in mid-March. Is that true?
Well,
And-
I didn't hear the question. I'm sorry.
Oh.
Is the mic on?
Someone was told that the out-of-town nurses that were brought to Corpus Christi to help with the COVID patients would be leaving in mid-March. Is that true?
You know, it could be. If you look at the numbers for hospitalizations and ICUs, they are going down, but that doesn't mean that we can't call them. If we need them again, we can call and ask for FEMA assistance at that time.
Okay, and do you think that the amount of nurses that we have locally is enough?
Oh, that's a tough question. So I think we could always use more, you know, because not only do we have swabbing clinics where we're still testing to see if you have COVID-19, now we have all these vaccination clinics. A lot of them utilize the nurses. And so, you know, currently we're using a lot more nurses than we would normally without a pandemic.
Okay, and then do you know how many out-of-town nurses that we've had to serve during COVID?
You know, I could go back and ask and look for you, but I don't have that number off the top of my head.
No, that's okay. And then, so my other question for you is, we were told that there were nurses sent to El Paso to aid over there. Do you know how many nurses from Corpus Christi have traveled in general to help with COVID?
You know, I don't have a specific number. I can tell you that nurses have been doing a lot of traveling. People that have worked here in our hospitals have taken other jobs with FEMA to help in different areas, El Paso, the Valley, even Houston and Dallas. And a lot of them have come back to work here, you know, more permanently. But there's been a lot of movement with nurses currently because the need has been there. And so wherever a nurse is, wherever they can go to help, that's where they're going to end up going.
Awesome. Well, thank you so much. That was one of my questions.
Thank you. If no other questions, thank you for being at the presser, and we will see you again next week. Thank you.